I am the baby of the family, so I'm the youngest. Have two older sisters, two-parent household. Both of my parents were educators. My mother was a math teacher and also a band director. She taught at HKT and Clark Middle School. And my dad is a band director. He taught down in Ruffin High School down in Waltersburg County, and then now currently is at William J. Clark Middle School. Early on, what sparked it was my mother. She suffered from a heart condition, and she recently passed back when I was a freshman year in college. And so I think for me, seeing the trials that she went through, dealing with the constant hospitalizations, going back and forth to the heart doctor, and as a child not knowing and understanding the severity of what she was going at, but actually seeing doctors that actually cared for her. Then I met my OBGYN, I think I was right before I got in the 10th grade, Dr. Richardson. He's retired now. And I met him, and at that time I was doing like some shadowing around the hospital, just doing like the summer enrichment program at the hospital. And I got a chance to shadow him. He actually told me the story about how I was born. I saw my baby picture in his office, and it kind of just really just sparked my interest from that day on. And I started getting the feeling of the joy that you see when you bring patients, satisfaction. They get better, or even if they don't get better, it's the fact that they see that you're caring and you're helping them. And just that patient interaction was something that I knew that I wanted to do for the rest of my life. I was a freshman, and I think he kind of left like right before I became a sophomore. But we kind of had that one thing we shared in common was he's a musician as well. And I can remember days that I would not be going to class, and I would kind of take a divot by his office, and we would just talk about like life goals. He would always kind of relate it to music. He always kind of give an encouraging word, and he always would say, hey, I knew you before you were born, and so don't act up. Well, you couldn't tell me my senior year out of all that I wasn't going to Clemson. I already had, my room and board, I had my schedule, I'd already auditioned for the band, everything was already lined up. Claflin was also a small school, and sciences, as that being your major, is very hard. And you really have to have people that really care about you, because, it's not a cakewalk, and, you're gonna have sometimes as you go through and you progress through that, those 4 years, like you may not pass. I knew I kind of wanted to have a holistic approach with patients. At one point I wanted to go into pediatrics. At one point I wanted to go into obstetrics. At one point I wanted to go into psychiatry. And as I went in those fields individually, I realized that it was not nothing I wanted to do full time, but I just wanted to have a piece of it to kind of make me feel whole. And that's when I came across family medicine, general practitioner, which, encompasses all of those into one. As an African-American male in the medical field, I want the children that's behind me to see that it is possible. For Orangeburg, it may not be big, it may have its ups and downs like any other place. I said, but Orangeburg is a very small place that has a lot of resources, has a lot of dedicated people that are here to nurture you and make you what you want to be. And I'm a prime example of that. Every place I've been, everything that I've ever received, it's all been based on connections. And all of those connections have started in Orangeburg.